Hey everyone, this is Dr. Lavell with Specific Health, and people often ask me, how does spinal decompression really work? Well, what it does, if we have a disc problems like this, where we can see that disc is bulging out, herniated disc in this example, spinal decompression creates a negative pressure on that disc to suck in that disc bulge or herniation. We use the DRX 9000 here. That's the one with the most research that's been done out there. That's consistently shown to create a negative pressure on the disc. It's a little different than traction. A lot of people say, well, what's the difference between traction and inversion table? Those are great maintenance tools. In fact, I recommend them to patients for maintenance. Doesn't really create a negative pressure according to the research. It drops the pressure down to about a positive 40, but doesn't go to a negative, whereas spinal decompression goes to a negative 200 millimeters of pressure. There's a few variables that allow that. Number one, the decompression table separates, which allows your pelvis to drop, which creates a mechanical advantage. There's also an air bladder that inflates that creates a fulcrum for further mechanical advantage. There's also the angle of pull is going to change based on which disc we're targeting. So if we're targeting a higher disc, it's going to be a different angle of pull than, say, L5, different angle of pull. So that allows for differences. With the traction table or inversion table, it's the same angle of pull. There's no separation of the table. Nothing changes there. And then lastly, the most important thing it does, it pulls in what's called a logarithmic fashion. So if, for example, when we have poundage with traction, it's just an increase in a steady traction. With decompression, that poundage is going to cycle. It's going to actually get bigger as it goes through within that period of time, what we call a cycle. And within that cycle, what's going to happen is there's this constant cat and mouse game going on. So if you want to grab someone's arm like you're shaking hands with them and you go and you pull against them, watch what they do. They're going to try to pull back. They're going to try to fight you. And that's the problem with traction, is that your muscles engage and now they're blocking everything you're trying to do. It won't let it happen. With decompression, that there's a computer that measures, according to the manufacturer, 13 times every 2 seconds. So when you pull and you start to pull back, it's going to back off. And that's going to allow that muscle to relax and stay relaxed. So it's this constant cat and mouse game where it's cycling back and forth in the poundage. So although it's maybe cycling, increasing in the poundage in the cycle, within that cycle, it's constantly going up and down. It's cat and mousing in order for you to stay relaxed on the table. It's very relaxing. Most people fall asleep. They find it very therapeutic when they're on there. So that's the main reasons decompression works so well compared to traction. So if you want to see if you're a candidate for this great technology, please reply back to us, and we would love to see if we can help you out. Thanks so much.